Okay, so we're going to go ahead and share screen, and we're going to go straight into our medical terminology. So itis, who remembers what itis is?
Inflammation.
Inflammation. Gastro or gastro.
Stomach.
Raphy.
Suture.
Suture. Ectomy.
Surgical removal.
Surgical removal. Nephr or nephro.
Kidney.
Kidneys. Plasty.
Surgical repair.
Oh,
You still have it.
yeah, I'm gonna fix it right now. It's not a surgical report, it's surgical repair. Oh, and now I don't have my caps on. Dog nabbit. There we go, we fixed it. Did I spell that right?
Yes.
I-R-R-E.
AIR is right.
Okay, thank you,
It just
Erin.
looks weird.
Scope,
Physical.
Visual.
visual exam. Algia, pain. Synthesis, this is a new one. Amniocentesis, what are we doing?
No, we're extracting fluid.
Yeah, puncture a cavity to remove fluid. So synthesis is puncture a cavity to remove fluid. So we're getting two new ones. I won't do a new one on Thursday since I did two this time. And then our other new one is endo, which means within or inner. Endo, within or inner. Synthesis, puncture a cavity to remove fluid. Did you guys have enough time to write that down?
Yes.
Hi,
Hello, everyone.
Lariana. So endo, I went ahead and added it in this week because once we start going through this right here, you're going to see endoscopy. So that's two words that we know right now that we're able to use and put together, right, to say what they mean. So if we did an endoscopy, we're looking within, a visual of within, right? So, all right, so I am going to go ahead and move to our CPT, and I'm open to our respiratory section. And I just kind of want to show you how I've tabbed. I have the nose. Well, I can never tell which way I need to go. The nose, sinuses, larynx, trachea, bronchi, lungs, and pleura. So the respiratory system is broken down into anatomic site. And that's just simply where I've put my tabs is on anatomic site. So as we go into, so I'm going to go to nose. Ooh, I'm trying not to shake y'all too bad, but we have things that are broken. It's further divided by things like removal of a foreign body, repair, excision, and when we go into sinuses, again, it's further subdivided by procedures such as incisions, excisions, introductions, removal of a foreign body, destruction, endoscopy, and other procedures. So the anatomic, it's broken down by anatomic site, and it's further subdivided by those procedures. So you'll be able to see that, you know, in the sinuses, we have an incision, and then endoscopy, excision, it broken down by those procedures after the anatomic site. Ooh, Antoinette, I love your hair. So does that make sense? Yes, it makes sense. No, it doesn't
Yes.
make sense. Yes, it makes sense. Okay, so I'm going to turn off the camera for just a minute so I can move the video back up to my face. And I didn't want to make y'all seasick while I did that.
Oh,
Here we go. Hi. Now you can see my face. Okay. So how are the codes for the respiratory system subsection of the CPT arranged? By what?
The area,
Ana-
the anatomic
anatomic
site.
site.
Anatomic site. And then after that is when it's subdivided even more into our procedures. So y'all understand that?
Yes.
Okay. Endoscopy is in all the subheading except for nose. So you won't find endoscopy under nose. Let me ask you this. Why did the codes in the nose subheading not include endoscopy? The reason is these are located in the sinus portion, because once you go up into your nose, what happens? You get into your sinuses like right away, right? So I wanted to make the point of that. And now I'm going to talk about the rules in endoscopy. You need to code to the full extent. And what does that mean? So if your procedure begins at the mouth and ends at your bronchial tube, where's your code going to come from? You can't code mouth, larynx. You have to go to the furthest extent. So your code is going to come from the bronchial tube, because that's where your procedure is stopping. That's when where that endoscopy stops, is that bronchial tube. Does that make sense? So even if the doctor is going to give you every little bitty bit of the part where he's doing the endoscopy, you go to where he ends. That's the full extent. So if he goes all the way into the stomach, guess what? You're going to go all the way to the stomach, and that's where you're going to pull your code from. Okay, that's rule number 1 on endoscopy. Rule number 2, you need to code the correct approach. Are you going through the mouth? Are you going through the nose? You need to pay attention to what approach you're using. So we're going to code to the full extent. That means as far as he goes. And then we need to make sure that we're paying attention to what approach. Through the nose, through the mouth, through the skin. And then we have one more rule on endoscopies. When you're doing a surgical endoscopy, it always includes diagnostics. So if they're doing some sort of a diagnostic test, it's included in that surgery procedure code. So if you're doing an endoscopy or removal, which is a surgical endoscopy where you can remove something, everything's included into that. So you're not going to go and have more than one code. It's going to be one code. So if they're diagnosing something, it's included into that surgical. I don't know why that's a rule. To me, that kind of just makes sense, because there's not going to be 3 or 4 different codes that's going to say this is specifically for diagnostics, or it's not. It's just a procedure code. So, but that is a rule, and I wanted to read you the rule. Now we're going to have another oscopy, is what I call them. A laryngoscopy, which is a visual examination of the larynx. So our oscopy medical term, which is visual examination, the laryngo is your larynx. So we know half of that. So remember how important those terms are to help us understand actually what we're coding. So if we don't know the beginning, we know the end. So we know that's a visual examination. What they use to do that laryngoscopy is a flexible lighted tube passed through the mouth or nose into the larynx. So there's an example there. We have to know the approach. We have to know if they go through the mouth, or we have to know if they go through the nose, right? So that's just an example of the approach. Who knows what intubation is? It's an endotracheal, sorry. Intubation involves a tube placed through the nose or mouth, through the pharynx and larynx, and into the trachea to establish an airway. So that's what intubation is. I think that I don't know if that's general knowledge or not. Did you guys know what intubation was? When you need to intubate a patient, you have to clear an airway.
Yeah.
Okay, and we're going to talk about thoracoscopy. Thoracoscopy, yes, I think I'm saying that right. And that is a visual examination of the chest. So THRORAC, that medical term means chest. And you can use that for diagnosis of lung disorders, diagnostic and surgical lung procedures. Those are some key terms that you're going to be seeing a lot of. If you get into your CPT, you're going to be able to see those in your subsection after your anatomic sites, right? Any questions?
Mhm.
Nope. Okay, so now we're going to do something else that's just going to help us get familiar with our respiratory system.
In order to stay alive, the body has to breathe air. We breathe in oxygen and we breathe out carbon dioxide. This process is known as respiration. Breathing happens automatically. Every day, the body breathes about 20,000 times. By the time we reach 70 years old, that's about 600 million breaths. All of this breathing occurs because of the respiratory system, which includes the nose, throat, voice box, windpipe, and lungs. At the top of the respiratory system, the nostrils bring air into the nose, where it's filtered, warmed, and moistened. Tiny hairs called cilia protect the nasal passageways and other parts of the respiratory tract and filter out dust and other particles that enter the nose through the breathed air. Air can also be breathed in through the mouth. The two airways of the nose and mouth meet up at the pharynx, which is located at the back of the throat. The pharynx carries both food and air and is used for digestion and respiration. One path is for food. This is called the esophagus, which leads on to the stomach. The other side is for air. It's called the trachea. A small flap of tissue, called the epiglottis, covers the air-only passage when we swallow. This stops food and liquid from going into the lungs. The larynx, or voice box, is located at the top of the trachea, the air-only pipe. This is where our vocal cords are. The trachea, or windpipe, which is a 2 to 3 centimetre tube, then extends downwards from the bottom of the larynx for about 12 centimetres. The walls of the windpipe are made strong by stiff rings of cartilage that keep it open. The trachea is also lined with tiny hairs. They sweep foreign particles and fluids out of the airway, keeping them from entering the lungs. The windpipe divides into 2 branches, and each one of these enters one of the 2 lungs of the body. Each branch resembles the limbs of a tree dividing into smaller, finer branches called bronchioles. The bronchioles end in tiny air sacs called alveoli, which look a bit like grapes. These structures enable fresh air to get to the air sacs, which are surrounded by tiny blood vessels or capillaries. The oxygen passes through these air sacs and travels through the capillary walls into the bloodstream. At the same time, carbon dioxide transfers from the bloodstream into the air sacs, where it gets breathed out of the body. When we exercise, the body needs more oxygen to feed the muscles as they work harder. The body responds by breathing more quickly and deeply. As the cells of the muscles use up more oxygen, the lungs have to work harder to keep up the supply. The respiratory system then speeds up to supply the body with much needed oxygen, and also to get rid of the carbon dioxide waste in the system. Over time, Exercising also helps our chest cavity to get bigger, which enables the body to increase the amount of air it takes in. More capillaries form around the air sacs, so the body gets better at swapping oxygen and carbon dioxide gases. We can see how the body's respiratory system helps the body to move about and is influenced by regular and ongoing physical activity as well.
Okay, so you could tell that he was not from America, right? Capillaries.
Capillary,
And did y'all
yeah.
notice how they spelled esophagus? Okay, so the next thing I want us to do is just a quick little this quick little exercise here. Oh goodness, sorry. Where we are gonna just decide what number 1 is, what number 2 is, what part of the body. So could anybody give me number 1?
Is it the nose?
Yeah, just the nose. What about number 2?
Mouth.
The mouth, yeah. Number 3?
The trachea.
Trachea. No, larynx.
It's the larynx. Number 4?
Lungs.
Yep, that's the lung. I'm having to look really, really closely at it. Number 6? Would that be the diaphragm?
Diaphragm.
Okay, number 7?
Where is 7?
Pharynx.
Let's see.
No.
If we look in the respiratory part of our, that's going to be our pharynx. If you look on page 212, there's a little diagram in your CPT. So that's going to be, yeah, our pharynx.
I thought it was the esophagus.
The esophagus is this.
Right.
Yeah.
Okay.
That's our esophagus. That's our larynx. Okay, number 9.
Bronchus.
Bronchus?
The left bronchus.
Yeah, we have a left and a right bronchus. I guess I left that one out when we went over it a while ago. Yeah, left and right bronchus are 5 and 9. What's number 10?
The lung.
Well, it's hard to tell. I think this is the lung. I think these are aren't these the bronchial?
Yes.
Right.
And then these things that look like grapes are,
Alveoli.
yep. So that was a neat, I mean, we've not done something like that before in class. I just thought it would be fun after watching our little video of our fella. But again, remember that you have this, the anatomy parts of your CPT that can always help you distinguish where something is, if you don't know. So the respiratory section, you guys are not going to have any trouble. It's small. I like it. I think it's fun. Digestive system, when it comes around, I love digestives. I like the gross stuff. I don't know why. All about the throwing up and the gases and the, I like the gross stuff. So anyway, any questions? Antoinette, I was fussing at you in my head a while ago. I was like, that girl better show up to this 11 o'clock class.